Good afternoon, everybody. I flew in over Lexington and was reminded of how gorgeous this countryside is. I spent a week actually bicycling through Kentucky 30 years ago, from Oberlin, where I went to school, to Nashville, where I worked after graduating for a while, and got to know a little bit of the countryside here. My brother was actually born in Kentucky. When my father, when my parents were here, my father was in the Army doing research. And we think about the value of research in changing people's lives around the world and around the state. I want you to picture in your mind a person who you know who's had a heart attack or a stroke, and a person who you know who's had cancer. At least half of all of the heart attacks, strokes, and cancers in this country and in this world could be prevented with easy, inexpensive interventions that are available to us today. So at least one of those two people who you pictured didn't have to go through that. The biggest challenge for health research, for public health, and for clinical medicine moving forward is how to be, as one program, focused on improving health status, whether we do that from the public health department, from the university, from the clinical provider, from the community health center, from the pharmacy, from the school, from the workplace. That's our biggest challenge in health today, and health is our biggest challenge in this country today. So that is our #1 challenge. And health services research can be very important in helping us to address that challenge. Now, what this slide shows is what I just said. If you look at 3 of the leading causes of death in the US, cardiovascular disease, cancer, and unintentional injuries, at least half, that's a rough estimate, but at least half of each of those conditions is preventable with current technologies. And if you look at how we're doing compared to the rest of the world, this is quite interesting, because if you just focus for a bit on the blue bars, that was just 15 years ago. We were better than a couple, not much worse than many, but over the past 15 years, the world has kind of left us in the dust. They have significantly reduced conditions that are preventable through health care, deaths from conditions preventable through health care, and we have not. The result of that is that we are making much slower progress than other countries. And the result of that is that chronic diseases are the leading cause of death and disability in the US. 1.7 million deaths per year. Half of all Americans have one or more chronic conditions, and more than 3/4 of all healthcare costs. And what you see is that this is not sustainable in our society. The number of Medicare beneficiaries continues to increase, and the number of workers per beneficiary continues to decrease. Medicare is dealing with the results of failure to prevent and effectively treat high blood pressure, high cholesterol, heart disease, diabetes, arthritis, and more. And as NACCHO has said, not only is our health status poor, but our inequalities are very large. Inequalities in health status are large, persistent, and increasing. Poverty, income, and wealth inequality, poor quality of life, racism, sex discrimination, and low socioeconomic conditions are the major risk factors for ill health and health inequalities. African Americans have a lower life expectancy than white Americans by 4 to 7 years for females and males, And heart disease is the leading single cause of that difference in life expectancy, with cancer number 2. The factors that affect health are at the base the socioeconomic factors that determine the structure of our society: poverty, education, housing, inequality. One level above that are things that change the context and make the default decision the healthy decision, whether that's clean water or iodized salt or smoke-free air or 0 grams trans fat or tobacco taxes that are high. This makes the default decision healthy. At one level above that are long-lasting preventive interventions like immunizations or brief intervention for problem drinking or colonoscopy or tobacco cessation. One level above that are clinical interventions, things that require the healthcare system to work day in and day out all year long: treatment of high blood pressure, high cholesterol, diabetes. And at the top level is counseling and education, encouraging people to eat healthy, be physically active. This is not to say that we should only do one or another level, although the impact of these interventions tends to be largest at the bottom and smallest at the top. But for any health program, there are interventions that have the potential to make a difference at every level of intervention. Our challenge is to identify the areas where we can make a difference and then systematically and objectively work to improve health in those particular areas. At the Centers for Disease Control and Prevention, we identified 6 key areas where we think we can make a really big difference. And I'll go through those one by one. Tobacco use remains the leading preventable cause of death in the U.S. Tobacco will kill more than 1,000 people today and every day this year. It will cost our healthcare system more than $100 billion. And it will expose more than half of our children to secondhand smoke. And yet we know what to do. We're making progress. Fewer people smoke now than have ever smoked before as a proportion. Smoke-free laws are expanding. We began running tips from former smokers, a hard-hitting ad campaign on tobacco. How many people in this room have seen the ad campaign? Can you just see? It's pretty good. We estimate that by the time the 12-week campaign finishes, 90% of smokers will have seen the ad at least 10 times, one ad at least 10 times. This is the first national advertising campaign against tobacco paid for by any part of the federal government. The budget for this campaign is less than what the tobacco industry pays in 2 days for marketing and promotion. So we're getting outspent in 2 days. We outspent for our entire year in 2 days of tobacco industry marketing and promotion. And yet, this campaign will be very successful because we have truth on our side and we have real people's stories on our side. I heard earlier from officials here in Kentucky that calls to the quit line in Kentucky have increased 5-fold since the ads began running. And we did not put the quit line number on most ads because we were afraid of overwhelming the quit lines. So this is an example of the kind of big difference that can be made. You see here graphs of the California experience and the New York City experience where smoking has declined by more than 1/3, teen smoking by more than half. Teen smoking in the leading jurisdictions in the U.S. is now at 7%, 1/3 the national average of about 20%. So progress definitely possible. Nutrition, obesity, food safety, and physical activity also critically important. A huge burden. Someone who is obese costs the healthcare system on average $1,700 more per year to care for. 1 in 6 people in the U.S. get sick every year from foodborne illness, and foodborne illness costs a lot. A single case of E. coli 0157 can cost $7 million.